I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agencies for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. Some individuals are born with paralysis or semi-paralysis on one side of the body. This is called hemiparesis. In children, this condition can be caused by damage to the brain before a child is born, at birth, or as the result of an accident, illness, or pediatric stroke. Recent studies show that the use of constraint-induced movement therapy, or CIMT, can improve the functional abilities of children in upper extremity hemiparesis. To speak more about constraint-induced motion therapy is Dr. Jennifer Semmel. Please stay tuned to today's episode of CHS Presents Health Connect.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
I never wanted to be associated with heart disease. I never wanted to be the poster child for heart disease. I never wanted people to know that there was something wrong with me.
Going through recovery from open heart surgery or being affected by heart disease can be incredibly isolating.
It's not easy on your body, on a woman's body.
I felt really alone because no one my age really had this problem, never had this issue.
And just knowing that there's a circle of women who know exactly the struggles I face every day and are there for me is so empowering.
I realized that I wasn't alone, and no matter your age or race, I made friends and found sisterhood and really found a second family that made me feel that I wasn't alone anymore.
There's so many ways that you can get involved. You can join the movement, you can volunteer, you can be an advocate, and you can donate. All you have to do is go to goredforwomen.org.
Being a foster grandparent has definitely given me a purpose in life.
I love Grandma Lydia. My favorite thing about Grandma Kara is doing a lot of fun activities.
Just been so happy, just so much more energy than being at home alone doing nothing but watching TV. It's the best part of my life.
I'm a best student because of her. She helps me with reading sometimes.
I am so proud of the work that I do here.
Best part of being a foster grandparent volunteer, watching the light up in the kids' eyes.
Couldn't be more satisfying.
It makes a difference that you get involved with young people.
Being a foster grandparent has been a wonderful, wonderful experience for me, and I'm not going to give it up.
I'm living again, and the foster grandparent did that for me.
Thank you, Grandma. Thank you, Grandma Carol.
Thanks, Grandma Jan, for helping me.
Welcome back to CHS Presents Health Connect. Joining us today is Dr. Jennifer Semmel, Medical Director of Physical Medicine and Rehabilitation at St. Charles Hospital. Thanks for being with us, Dr. Semmel.
Thank you for having me.
Well, it's great having you here, and I am such a huge supporter of the work that you and St. Charles do in this area. Can you tell our viewers at home a little bit about what exactly is constraint-induced movement therapy, or CIMT?
Sure. Constraint-induced movement therapy is a therapeutic treatment for individuals primarily after a stroke in which they've developed a dominance for one side, and we're trying to restrain that side and actively work with the other side to help them gain new skills.
So actually the side that's damaged, you're actually helping them relearn how to use and get skills in that affected limb.
Correct. There are a variety of protocols, but most of them are 3-week-long intensive trials working hard with the hand that is less dominant or impaired,
yes,
while we restrain their dominant arm.
Oh my goodness, that's incredible work. Who would be a candidate for this type of therapy?
Sure. The initial research was actually done in adults chronically after stroke. You know, going back 30 years, the thought was you had a stroke and there wasn't much. You could work around it. You'd have therapy. You'd do your best to get your balance back and get mobility back, but that you couldn't change the way the brain worked. And over the last 20 years, particularly with some of the newer research models, we can see that actually tying down the dominant arm and making somebody use their impaired arm changes the way the brain actually functions. And it's really fascinating to look at some of the studies on this. So the work in adults showed some benefit to this even years after stroke. And our goal was to try it in children with the thought that these children haven't used their limb and learn to use it. So number one, if you don't use a limb, it's going to be smaller in size, smaller in length in a child because it never gained the skills. And so if we could catch them at a young age, old enough to be in camp, but young enough to participate and enjoy a summer camp situation, that we actually might change their outcome. And we've been very happy with the results that we've seen.
It's really incredible. So what can someone expect during therapy? I mean, what's a normal course and some of the outcomes that you've been able to achieve?
Sure. The traditional constraint-induced movement therapy, or CIMT, runs for 3 weeks of 6 hours a day of intensive one-on-one treatment. So the best way for us to do that, since most insurance isn't paying, it started actually because I had families that were flying out of state and paying an exorbitant amount of money to participate in some of the initial centers for this. And that seemed, concerning to me because parents will do anything for their child. We tried to find a way where we could do this, number one, locally for our population on Long Island, and two, in a way that was cost effective for the families. So what we came up with was a summer camp where we have therapy students that now it's become increasingly popular. We have lots of applicants to be our staff that works with the patient. So for every child, there's a staff member with them. And then we have a leader who is an occupational therapist who runs the camp and oversees the whole program and does activities with the kids from 9 o'clock in the morning till 3 o'clock in the afternoon.
So pretty intense.
It's an intensive program. I mean, I'm astonished because we have kids as young as 3 years old participating in it, and they do well.
That's incredible.
Yeah.
Are there any side effects or risks with this?
We've been pretty lucky.
Yes.
The answer is there's always a risk because you're tying down their dominant arm. So, prior to this, if they were to fall, that would be the arm that would catch them. So the concern is their only arm to catch them is their impaired limb. So there's always a concern of fracturing because you have a full arm. I mean, we go all the way up to the armpit and down to the tips of the fingers with a cast.
You put a cast
we've tried different things, but over the course of time, if you leave even the fingers out, they'll try using the fingers to do activities. So we do a splint that goes all the way to the end of the arm and up to the armpit. And fortunately, with the one-on-one staffing that we have set up, we've
so let's talk a little bit about that then in terms of the staffing. You mentioned that you've got is that a 1-to-1 ratio? So each child has a therapist, and then there's an overarching, if you will, occupational therapy leader as well?
Yep.
How is it structured?
It's structured that, exactly as you said. There is one person with each of the children. That person goes through training prior to us starting the camp under the oversight of the occupational therapist. We have music therapy come in. We have a variety of different folks. I mean, fortunately, we can draw on a hospital that's really geared in many ways towards rehabilitation. So we can draw upon the specialists from different areas to come in and do their PIT, which is helpful. It changes some of the scenery for the kids. You know, 6 hours is a long day, so it provides some distraction.
Wow. So again, you mentioned it's a 6-hour treatment day, and that you found the best outcomes are achieved when this is kind of set up as a camp. So how I mean, my daughter goes to camp. It's depending on how much we can afford to send her to. It's 6 weeks, it's 8 weeks, whatever it is. How long does the camp run?
It runs for 3 weeks.
Okay.
So pretty much every morning, our chapel entrance looks just like a summer camp. You have parents driving up, dropping off their kid, picked up by their one-on-one staff member, and they come down to camp, and then 3 o'clock in the afternoon, they're picking them up. So it runs for 3 weeks, and at the end, we have a several-hour celebration with videos of the kids showing their progress. It's a great day. It's a nice.
Have you seen kids, do children come back? So in other words, you know, they come one season for camp, obtain some gains and some improvements, and then they come back and there's just successive progress? Or how many repeat people come back? Or
So what we had the first couple of years is everybody wanted to come back. So it made it a challenge for us to allow new kids into camp. At this point, we have children, we have them come back for 2 years. It's been proven actually to have good outcomes after 1 year, and repeating it also shows an incremental benefit over that. So we felt it was the right thing for the kids to at least do 2 years. So most of our patients, or children I should say, do 2 years of the summer camp, and in the 3rd year we try to come up with a program that they can do on their own. But,
this is just really some incredible work. We look forward to coming back and speaking more about CIMT in a minute. Please stay tuned to CHS Presents Health Connect.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy. And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
Here's something we bet you didn't know. Nearly half of all cancers can be prevented. That's right, half. Nearly 50%, mostly by making small everyday changes in your diet and controlling your weight, walking more, eating less, and eating foods that help you and your family to seriously reduce the risk of cancer. And of course, by not smoking. Visit the Cancer Prevention Together We Can website and get a free 30-day planner filled with tips, recipes, stats, and more about protecting your family. Go to prevent50.org.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just, please, don't leave. Okay, but remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
When I lost my sight, the only thing I had was reading.
Whatever your needs are, 99.9% of them can be met by the NLS program.
You can choose from large print or braille or audio.
It's a free service. It's amazing how much you can get.
For information about the Braille and Talking Book program by the National Library Service for the Blind and Physically Handicapped Library of Congress, visit loc.gov/thatallmayread.
Welcome back to CHS Presents Health Connect. We are continuing our conversation with Dr. Jennifer Semmel, Medical Director of Physical Medicine and Rehabilitation at St. Charles Hospital. Welcome, Dr. Semmel.
Thank you.
So let's talk a little bit more about, because this really is cutting edge work. And I know that viewers are going to see some video clips on the kids going through this treatment and the outcomes. But are you doing any research in this area? Anything else that you'd like to share in terms of the program with the viewers at home?
Sure. In terms of the pediatric population, we actually published about 5 or 6 years ago our initial research on our first few years of the camp, looking at what we call durability of outcomes. So we certainly knew that the camp helped for the several weeks the kids were in camp and they had better outcomes, but we wanted to know how long that effect lasted. So we tested the kids before the camp, at the end of camp, at 3 and 6 months. And actually we showed a benefit at all of the levels. So while they improved at the end of camp, and some of those skills, once you stopped restraining their arm, some of that, the gains were slower, but still 6 months afterwards, they actually did better than they did before the camp. So we were pleased to see that at least it lasted that long. Wow. And our thoughts are, in some of the adult studies, it's showing it's lasting 2 years or so. So we haven't checked the 2 years because we're involving them again at the second year. So we're seeing their numbers then.
Yes.
So in the pediatric population, we certainly know that we're showing nice results. In the adults, we actually are just starting a research trial with our inpatients, because while it's helpful with patients on chronically following a stroke, we want to know how much better do our inpatients do if we try an intensive program right off the bat.
Right.
And that's what we're actively looking at now on our inpatient unit.
That's
so
very...
it requires a little bit more time, a little bit more intensive than a
cutting
traditional
edge.
program, but
cutting
edge, and it'll be nice to
right
see.
here at St. Charles Hospital on Long Island. See, that's just really incredible. Let's talk about, I always get asked questions, as I'm sure you do as a physician and leader, how do we measure outcomes? So what are some of the outcomes? And there's this whole big debate now in the medical literature in terms of some of the outcome studies and things that we look at. So what would be some good functional outcomes that you track and monitor or have seen as a result of CIMT?
Sure. There are a number of different traditional scales used. Some of them are parent observational ones, which we definitely do, and we're pleased with the results. The parents are all saying positive things about what they're noticing. Children who wouldn't feed themselves with their impaired arm are now using that arm more than they're using their dominant arm, so those results are showing positive findings. And then Quest is probably the most commonly used research tool, and that's also what we're using as an outcome measure, which is the quality of upper extremity function and dexterity, etc.
Oh, so that's actually a scoring mechanism to actually grade how well the child is able to functionally use the limb after treatment.
Correct. Yeah.
And what are you finding?
That they're improved. Our studies are showing that from 0 to 6 months, we're seeing an improvement in their Quest scores in the children, and more than you'd expect just based on age. As kids get older, they get new skills, but it's even more rapid.
So what happens after the 2 years? I mean, do you then move on to help perhaps teach parents on how they can continue this? Can any component of this be offered in the home?
Right. There are therapists in the community that are trying to piggyback on our work, so they're doing what's called modified constraint-induced movement therapy, so it's for fewer hours, and they're using the same splint in some cases that we're actually making for the camp. We, actually, my nurse practitioner and I are the ones that help make the splint before camp starts, so we make something that the parents can still use after camp is over. It opens, it has Velcro closures, so they can continue to use that in home when they're in their sessions with the staff. We don't want them doing it without a staff member with them, just based on their age.
Right. So really, again, getting back to everything we say, really putting the patient in the center and involving the family and patient-centered care. How could someone, if someone's watching this at home and they happen to know of a family member or a friend that has a child with this type of condition that needs help, how can they apply to attend the CIMT camp?
Sure. The first step would be to reach out to our Director of Outpatient Rehabilitation. That's Laura Beck, and her number would be 631-476-5606. And she would be able to give them some basic information about the camp. And thereafter, we would set up an opportunity for me to meet with the child, because we want to make sure that their arm has enough active movement that they would benefit. For a child who doesn't have the ability to open their hand or extend their wrist above what we call neutral position or here, they might be frustrated if their hand is always fisted. If we, restrain their dominant arm, that we could set them up to just have a frustrating 3 weeks. So in some cases, we can help that with different taping mechanisms or muscle relaxants to make that able to do more. But we would want to assess the child to make sure they're a good candidate.
So
for
reach out to Laura Beck, get in, get screened, get evaluated by you and your team to see if you're a candidate that you would really be able to benefit from this treatment. I've seen the video. The outcomes with the kids are so incredible, and the children are so committed to this. They're really engaged and wanting to improve. Now, I want to share with the viewers at home and ask for help and support. I mean, obviously, we would love to see support from the community and have some donations come in to help support this wonderful CIMT camp. Can you share a little bit about what would be a mechanism that we can go about doing that?
Sure. The hospital does rely on donations to offset the cost of the camp. Obviously, having one-on-one supervision for the kids costs a fair amount when you're talking about a 3-week summer camp. So we do rely on outside support to help sustain. Parents will pay what a traditional summer camp would cost, and the additional difference is made up by private donations. So those are always helpful to run the camp.
You have my support, and I just say for the families out there, that you think about what you're doing with your child, sending your child to camp perhaps. Imagine if you're the parent of one of these children that have one of these developmental disabilities, and the work that's being done by Dr. Semmel and the team at St. Charles Hospital to really help them along in their life's journey. It is incredibly powerful. The results are phenomenal, and I just would ask for your support to reach in and contribute whatever you can. Every dollar helps for our children and to help them get well. So I want to thank you, Dr. Semmel, for being on our show today and sharing the remarkable work and results of the CIMT camp. Thank you. We'll be right back for my final thoughts and my health tips and solution of the day. Please stay tuned. So some final thoughts on our discussion today around constraint-induced movement therapy in the CIMT camp at St. Charles Hospital. You know, for parents who have a child with these types of conditions, it can be an incredibly stressful time, incredibly stressful for the child as well. And one of the things that I saw in the children that go through this, they don't just get the physical improvement with the therapy and that the limb improves in its overall functional outcome scoring, but you can imagine a child may feel that they're the only ones with this type of condition, yet they come to this camp and they meet 10 or 11 other kids that have the same issues. And they kind of all work together and form this incredible peer set. Parents get to know each other, and it's just an overall incredible healing experience. So I always say it's not just about the physicality of what we do, it's about the mind and the spirit as well. And I think this program really embodies all of that in helping people along on the path to health and wellness. And now for my health tip and solution of the day. With so many experts out there, it's hard to know what is factual and what is not. I'd therefore like to share with you truth in medicine, with no spin, no marketing, just the simple, unvarnished truth, as well as some trusted sites for information you can reference from home. I hope you'll find this information beneficial, and as always, I wish you a healthier, happier life. Today, we'll be discussing the pros and cons of lung cancer screening. As with all of my tips, I'd like to offer one great source of truth, and this one is from the American Cancer Society at www.cancer.org. People wonder whether they should schedule a CT scan, that's a CAT scan of your chest, to determine if they have lung cancer. What are the benefits, and do they outweigh the possible risks? The United States Preventive Services Task Force, an independent panel of experts authorized by Congress to make recommendations about preventive services for patients without signs or disease symptoms, studied these questions and issued a recommendation stating that those at high risk for lung cancer get a low-dose radiation CT scan annually. Specifically, they targeted current smokers or those who quit within the last 15 years, who are between 55 to 79 years old, and who have had a 30-pack-year smoking history. This breaks down then to a pack of cigarettes a day for 30 years or 2 packs a day for 15 years and so on. You get the idea. The USPSTF recommendation recognizes that low-dose spiral CT can save lives when done on these types of individuals while balancing the potential harm associated with the radiation from such screenings. Low-dose CT can potentially detect cancer earlier when it's easier to treat, but also can find abnormalities that eventually are determined not to be cancer. Analyzing such irregularities could lead to additional scans, more invasive tests, or even surgery. Generally, these risks may outweigh the benefit of screening for all, again, except those at higher than average risk for lung cancer, such as heavy smokers. Remember, screening should not serve as a substitute for quitting smoking. As always, the most effective method to reduce the risk of lung cancer is to avoid tobacco. You can find tips to help you quit on the American Cancer Society's website at www.cancer.org. That's my tip for today. For more health information, watch CHS Presents Health Connect, airing on Telecare and CBS TV 55. To view recent episodes, go to CHS's YouTube channel. If you would like to know more about CIMT, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like for me to answer on future shows, please email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.